there's something that's now come up on the horizon that makes me and other health experts nervous, and it's what's called COVID virus mutations, or viral virus variants, we call them. So you have to remember that the virus goal is to infect hosts, infect people, and force the body, the host, to start to make multiple copies of the virus, to throw it out there so that other viruses can get out and infect other hosts. So as it's doing that, it's making hundreds of thousands of copies of virus. And as you do that, the virus starts at times to change. Genetics start to shift and genetics changes start to happen. And when those genetics happen, you can sometimes get a virus that all of a sudden becomes almost a little bit different than what it started out as. And those changes, if they're involving parts of the virus that cause it to be infectious, or causes it to cause a severe illness, if those changes cause it to be more severe of an illness, it definitely impacts us as a society who are going to be exposed to that virus. Unfortunately, we've seen now 3 variants that have been genetically studied in the world right now, coming from 3 different areas of the world. One coming from the United Kingdom, one coming from South Africa, and one coming from Brazil. The reason these have been looked at and have a lot more worry to them is that these variants, these changes in these viruses, seem to affect what's called the spike protein. The protein that is on the outside of the COVID virus, the SARS-CoV-2 virus, that this is what we're using in technology to make these vaccines protect us. They're looking for the spike protein, they're using the spike protein, they're causing production of spike protein in the body. Well, so the UK variant changes enough of the spike protein to make it more contagious. They think it's 4 to 7 times more contagious. So if I get this virus, I have a greater likelihood of spreading it to multiple other people in more of a shorter period of time. So it's more contagious, which in and of itself is not a good thing. But it doesn't seem to be causing increasing death from COVID with this variant. However, these 2 variants from South Africa and Brazil do seem to cause a higher level of COVID illness, more severe illness, and increasing levels of death with it. And here's my example that I want to show you. So remember, we have the SARS-CoV-2 virus with the spike proteins. We have our body's reaction. So if our body's doing what we're supposed to do, we're going to make all these antibodies that are in the body, as well as the immune cells that are there ready to fight off this virus again going forward. These antibodies identify and directly look at and link up to these spike proteins, and those antibodies glom onto the virus and get it out of your body before it can become a problem. So the spike protein has been the key of how the body identifies the virus and how we fight it off. But let's just pretend that we have the South African variant that's changed its genetic material enough that all of a sudden the spike proteins aren't the same. Now, instead of being red, they're more of a black color, and maybe they even look different and have different chains on them that make them look different. Well, now I have an antibody, all these antibodies here that are floating around. All of a sudden, these antibodies that are floating around the body, it can't really identify, or it doesn't identify with these spike proteins as well to be able to glom onto the virus and get it out of the body. So all of a sudden, the virus has evaded our body's immune system and antibodies to get rid of it. So it's a scary thing, because if we now have a virus that's evolving that doesn't respond to all this we've set up with our vaccines, we are back to square one in some regards, where this virus is going to keep going and causing more illness, more death, and more closure of our community. So the biggest thing we need to be aware of is that these variants are out there, and they are continuing to change. So the 2 things I want to end with is, we need to vaccinate. We need to push vaccines as quickly and in huge numbers now more than ever, because the more people we can arm with protection, the less chance we have of viruses being spread in our community to begin with. And that's going to make a big difference in everyone's lives and well-being. But the second thing we need to bear in mind is these variants are still out there, and until we have more and more people vaccinated, we need to smother these viruses out. And the only way right now we can smother them out is to not spread it to other people, not get COVID-19. We still need to follow the same rules we've been following with mask wearing and staying distant from individuals that don't live in your household. We need to avoid gathering in large groups of people that potentially could spread, because right now we do have the UK variant in the state of Iowa. But if one of these other variants starts to wreak havoc on a community and people aren't following rules of trying to prevent that spread, we may be back to square one and more people getting sick and dying again. So we're not out of the woods. I would just say that the vaccinations that we have are extremely powerful and give people a huge amount of protection themselves from getting severe COVID-19 and being hospitalized and dying. So I'm telling everybody, vaccines that we have right now are wonderful. And if you can get one when it's your turn, get a vaccine. But the other thing we need to bear in mind is these variants are out there. And the only way right now we're going to keep them from continuing to spread is by not spreading them to other people and avoid getting sick by following the rules of mask wearing, social distancing, and avoid gathering in groups. Thanks.